This is the topic for the precocious puberty. Just one moment. So this is precocious puberty. What is the definition of the precocious puberty? What is there any difference for the male and the female? Sana, you please interact with me. You tell me what is the definition of precocious puberty. What is a definition is basically puberty is a normal physiologic phenomenon that is normally present at some specific age. Okay, precocious means the thing that was going to happen after this typical age. These signs and symptoms they are present earlier. How? What is the duration for that? This is different for the male and the female. Normally, the puberty present in female after 8 years of the age and in the male after 9 years of the age. So for this, we have to learn what is the first sign of the puberty. If you see this picture, this is not, this is the picture which is showing this is a boy whose age is most likely less than 9 years and he is having some signs of puberty. Okay, this may be a sign of puberty. This is normally not present in the children and other in the male. Okay, so for every sign which appears we have to know what hormone is elevated. If this mustache is present, which hormone is increased in amount, and what which hormone is basically responsible for the formation of this feature. Okay, see here, if we see this picture, yes, this is a child, this is an infant who is having some signs of puberty. Okay, which hormone is increased we have to know. Just 1 minute. Okay, so these two pictures they are very normal pictures, but they are giving us some message that is a precocious puberty. Okay. This is the definition. If we read this line, I'm going to read this. A 3-year-old child presented to a clinic with mother concern for the breast development. How will you approach this child and the family? I have circled three things here. Why I have a 3-year-old child? I have, this is not a case of ambiguous genitalia, and I'm not talking about that congenital adrenal hyperplasia. Why I have written the word child here? Why not a boy and why not a girl? Basically, I have deliberately written here the word child. Why? Because breast development is the function of which hormone? Does male have breast? Do male have breast? Yes. Female have? Yes. Okay. So why I have written the word child? This is because we have to categorize if this problem, if this secondary sexual character is present, that belongs to mainly to male or female. Breast development is mainly belongs to female. Okay. If a male develops breast, that is a different thing. If a female, she develops breast before 8 years of the age, that is a different thing. Okay, so we have to recognize this is isosexual precocious puberty or heterosexual precocious puberty. Okay, for this we have to know the basic understanding of the hormones and their function. Androgens and estrogen. What is the function of the androgen and what is the function of the estrogen? What is the function of the androgen in the male? What is the function of the androgen in the females? Okay, all male and females they do have androgens. Likewise, the female. What is the function of estrogen in female and what is the function of estrogen in case of male? Male also have estrogen, female also have androgens. So this will define our, this is isosexual precocious puberty or heterosexual precocious puberty. Okay, suppose I give you a scenario. Like a male, a female, she is 6 years. She comes to you with pubic hair of stage 2. Okay, which hormone is elevated here? Is this isosexual or heterosexual? Which hormone is elevated? Pubic hair formation is the function of which hormone? Androgens. Okay. So testosterone. It means testosterone is elevated. In case of a female, she is presenting with pubic hair at 6 years of the age. Okay. What is the source of the testosterone in female? Where it is being produced? Lyric cells in female. Lyric cells in female? No. Lyric cells are the cells of the testes. These are the follicular cells. Alright. Suppose this is testes. These are the follicular cells. And here you do have these lyric cells. These lyric cells, they are producing, yes, you are right, they are producing testosterone, but that is in male. Okay, likewise in female, this is the ovary. These are the follicles where follicular FSH is acting, and like this is the connective tissue cells. These are the theca cells, connective tissue cells, which are present between the follicles. In case of female, they are known as theca cells. Connective tissue cells, which are present between the follicles in male, they are known as Leydig cells. The function of both these connective tissue cell is production of the testosterone. Okay, in male or in case of female. So where is the problem? Is this female having any hyperplasia, any tumor of these follicles? No. Why? Where is the hyperplasia? This theca cell. That may be a case of theca cell tumors. Maybe or may not be, this may be a case of premature adrenorrhea. That is a normal variant. We will discuss it later. Here I have told you, like whenever any child before 8 years female and before 9-year male comes to you with any secondary sexual characters, that may be testicular enlargement, that may be pubic hair formation, that may be breast enlargement, that may be menarche in case of females, you have to see this is a case of precocious puberty. My next step is to learn, is this central precocious or peripheral precocious? Okay, central precocious also known as isosexual, and this peripheral also known as heterosexual, where a male may have features of the female hormonal excess, and in isosexual he is a male and he is having secondary sexual characteristics of the male before 9 years. Okay, now they say like we have to know precocious puberty, is this normal variant or precocious puberty, is this central or peripheral, isosexual or heterosexual. Okay, these are the growth phases. I am not going to discuss at this time, just because like there is a fetal phase, infantile phase, pubertal phase, childhood phase. Pubertal phase is present in the all phases where the any child, any person, this is basically transition from the childhood phase to adolescent phase. Okay, in simple words, like this is a stage where you can reproduce, entering into a age where you can reproduce. It's the age of the reproduction. So this is a transition phase from this side to this side. Okay, why it is present at specific time? If this like this is going to happen at this age, why not at this age? Why not at this age? Why this is a normal phenomenon. If it is slightly contracted, why I'm saying this is abnormal. It's going to happen. It will happen, but why? Just it's occurring like this much duration earlier, and I'm saying this is abnormal. I have to go for hormonal levels, for MRF, and for all these investigations. Okay, so this is basically how puberty comes. There are two phases. There are two hormones which are controlling these presence of these secondary sexual characteristics. If you see this slide, I have made one bracket over here and two separately here. Why not total is like this? Okay, there is hormonal control. Number one, this is because the first one, two, three, they are not under my control. They are decided when I was a fetus. Okay, and these two things they are under my control. These are the things which I can control to make any child have secondary sexual characteristics appearing before the normal age. Okay, so the things which are not under my control, the first is that is genetically determined. Just 1 minute. Okay, now my voice is clear. Voice is low or normal. Okay, what about my voice? Okay, so the first thing is that is genetically determined. All right, if I have to be precocious, that is first, that is determined. That is under control of the inhibitory hormones, that is GABA. This is the GABA hormone, like this one, that has a negative effect on this hypothalamus and pituitary axis, which is going to release these gonadotrophic hormones. This GABA, that is inhibitory. When the time comes, like at 9 years of the age, this inhibitory hormone it is decreased, and this excitatory hormone, that is glutamate, it is increased. It is going to have a positive effect with the release of this gonadotropin releasing hormone. Okay, so we all know it's going to act here, 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 and these hormones they are produced. The things which are under my control, that is leptin mediated nutritional effects. What is this? Increased leptin. Okay, increased weight. There is leptin mediation, which causes what? Which causes the release of positive effect on the gonadotropin releasing hormone excretion. So the girls who are obese, they become mature early as compared to the girls which are thin. Okay, so if we recall our patients, we see the patients who are chronic disease, who are very thin and lean, they also have a problem of delayed puberty. Okay, so this is because of this leptin causes a positive effect on these hormones, and when there is decreased leptin, like in thin and chronically or mentally deprived patients, environmental factors. This is basically mental deprivation. They have delayed puberty. So they say these two things are under my control. I can eat normally. I can have a good environment around me to make my mental health and definitely our sexual health important. That is very important in a normal phase. Okay. So this is the slide which is telling why puberty is going to happen at a fixed time. Okay. Next, this we all know what are the hormones. I will make it. Okay, we have two axes like hypothalamus pituitary gonadal axis and hypopituitary adrenal axis. Okay, mute yourself, please. Please. Okay, so why I have talked about these two axes? If I'm talking about precocious puberty, I'm talking about sex hormones. Why this the adrenal gland? This is because we have the source of the sex steroids. This is number one is the gonadal hormone, and number two is the adrenal hormones. We have the main source of the androgen, especially in the prenatal, in the fetal life, that is the adrenal androgens. You will see the child, the fetus who has problem in the adrenal gland, they are going to present to you with a congenital adrenal hyperplasia, where there is hormonal imbalance. So it means from the your gonads, these hormones they are going to produce later on in the fetal life, they are mainly produced by this adrenal gland. So, if you find any disturbance in the pituitary axis and in the adrenal axis, you may have signs of precocious puberty. And if we think like the problem goes like this is hypothalamus, then this pituitary, then this gonads, usually these usually present with isosexual characteristics. Okay, when it goes like this, they usually may have heterosexual. Although isol and heterosexual may be present in this form and in this form both. Okay, so this is the talking about the gonadal axis and adrenal axis. Okay, we have to know what is the function and what is the source of production. This is basically will lead you towards your diagnosis. Okay, see here, this is the hypothalamus. Hypothalamus that is going to produce melatonin releasing hormone. It's acting on pituitary. We do have LH and FSH. Okay, what is the function of the LH in the male and in the female? These are the gonads. Okay, so here I'm going to make this testes. Okay, these are the follicles and these are the Leydig cells, connective tissue cells. In case of female, same here, this is the ovary. We have these follicles and we have connective tissue theca cells. Okay, see here, this FSH, it is going to act on these follicles. In the male, it's going to act on these follicles. Okay, what it is going to produce in the female? What it is going to produce in case of female? That is estrogen. Okay, that is estrogen. Whenever a female comes to you, okay, whenever a female comes to you with breast development, the main function of the estrogen in female is breast formation. A 6-year-old child, a girl comes to you with stage 2 or 3 of breast development. We said this is precocious puberty. So, is this central or peripheral? It means there is some problem here. Either she is having increased level of follicle stimulating hormone from the central side, or she is having increased production of the estrogen by these follicular cells. Okay, and what may be the other source of this estrogen? So, most likely, what is the source of this estrogen in case of female? Always remember now this is the clinical point here. Okay, female has this source. Production is by the stimulation by the follicle stimulating hormone. Any female child presenting to you with breast enlargement as a first sign or at any stage, this is most likely a central precocious puberty. It is not a peripheral precocious puberty. Breast formation in case of female may, unless she is proved otherwise, this is a case of central precocious puberty. Why? We say FSH produced here, it is going to produce estrogen, and when it is producing increased amount, it is going to form the breast in a girl. Okay, so this is most likely a isosexual and central precocious puberty. Okay, now see what is the source. Next, we will talk about the LH first. Okay, where this LH is going to work in case of male and female. In the female, this LH, it is going to act on the theca cells and going to produce what? That is testosterone. What is the function of the testosterone in female? That is pubic hair formation. Okay. So always remember the testosterone which is produced by the this theca cells, it is in decreased amount. This is not the main source of formation of the pubic hair. The testosterone, the androgen, which is produced from the adrenal gland. From where? From the adrenal gland. This is mainly going to produce pubic hair formation. So any female who is coming to you with pubic hair formation, maybe stage 2 or 3 or whatever it is, the main source of this is, it's not this theca cell tumors. That may be, but the main source is the adrenal formation. Okay, so you came to know, like if any child is coming to me with puberty, I go for the adrenal investigation. Any female who is coming to me with this breast formation, I go to this MRI brain. I go to this source of FSH formation. This is because, yes, this LH is going to produce testosterone, but this testosterone from the gonads is not mainly responsible for pubic hair formation. Pubic hair formation, the source is mainly the adrenal androgens. Okay, you got my point here? Puberty, you will go for urinary steroids to look for the adrenal problem. Breast development, you will go for the MRI brain, central precocious puberty. Okay, clear? Okay. So if we talk about the first differential would be adrenal, our second differential would be theca cell tumors. Okay. Now let us talk about the male. So when we did these recalls, we came to know in case of male, these are the testes, follicular hormones, and these lytic cells which are going to produce testosterone. Okay, LH, FSH. What is the function of the follicle stimulating hormone in case of male? What is the function of FSH in male? FSH in male. What is function? Aisha, are you here? Pubic hair and axillary hair. What is the function of the follicle stimulating hormone in male? Okay. We see follicle stimulating hormone is going to act on the follicles. Okay, in the follicles we have two type of the cells. Number, these are the Sertoli cells. The function of this is basically spermatogenesis. It's going to produce sperms mainly. And what is the function of the Sertoli cells? They are going to produce this inhibin hormone. What is that inhibin hormones? It inhibits the female characteristics, female gonadal internal genitalia formations, Mullerian duct inhibitor. Okay, so follicle stimulating hormone basically is not going to produce any hormone which is going to help in the development of the secondary sexual characters. It is going to inhibit female in male, all right, Mullerian inhibitory hormone, and it is going to produce sperm in case of male. So definitely that it would work at a specific time, not very early. Okay. LH is going to produce testosterone. What is the function of the testosterone in case of male? In the like this fetal period, the testosterone which is produced from here and from the adrenal glands, its main function is the formation of the internal genitalias. Okay, this testosterone that is converted into dihydrotestosterone. What is the difference in the function of this testosterone and dihydrotestosterone? Anyone, please? What is the? Is there any difference between the function of the two? Is there any difference? Okay, the function of the testosterone in case of male, that is the formation of the internal genitalia, right? And dihydrotestosterone is the formation of the external genitalia. You got my point? Like penile formation, testicular enlargement, okay, internal genitalia, epididymis, and all other seminal vesicles and other tubules. This is the main function of the testosterone. Okay, so in is a central or peripheral. Any male coming to you with testicular enlargement. This is a case of central precocious puberty unless proved otherwise. You got my point? Breast formation in case of female, central precocious puberty. Testicular enlargement in male, this is central precocious puberty. Pubic hair formation in the female, this is this may be a premature adrenarche or that may be a case of peripheral precocious puberty. Okay, pubic hair formation in case of male where testicular volume is normal, this is a case of peripheral precocious puberty. Okay, clear? Sana, it's clear up till now? Okay, so see here, this is the line which is telling, remember there is pulsatile release of the gonadotropes. See here, like this is the time she is 9 years, there is pulsatile release of the gonadotropin hormones like this, which are responsible for the normal puberty or formation. Okay, when there is continuous high release of this gonadotropin releasing hormones, it is not going to produce puberty. Okay, clear? Okay, so these are the hormones basically. Now this is for the female. Why the sign here? They say not at this time basically. This is the normal puberty when it happens in the female. It's between 8 to 13 years. Breast word is the first sign when breast enlargement is present. This is central precocious puberty when pubic hair and accelerated growth part is it's immediately after this. 2.5 years later. Okay, growth spurt. Not this is the picture. This is basically showing us what are the exact timings of the puberty. Like we have sign for the male, like that is from down up. The first sign of puberty in case of male is testicular enlargement. Second one is the pubic hair formation. Then the patient may have this axillary formation, and after that this beard formation along with this. Okay, so in case of male, the signs appear from down to above, from downwards to above. Okay, so this is a male. All right. In case of female, the breast formation is the first sign of puberty. Second step is the pubic hair formation, and third step is the menarche. Okay, so this is a female. The signs of puberty appear from above down, like this. That we may say like this. So this is a female. What is the normal time of duration of puberty here and here? This is almost 2 to 3 years, and this is almost 4 to 6 years. So that is why the males are always taller than the female of the same age. Why? Because When this is basically when your these epiphyses they grow, they unite with each other. They send signals to your pituitary to release the gonadotropin releasing hormones. Like why they say there is no increase in the height after menarche or puberty. This is because we see this is the bone, all right. This is the epiphysis. This is the this bone is going to meet this epiphysis. The epiphysis is going to meet it like this when they come very close to each other, when they are just to unite with each other, they send signals to the hypothalamus and it is going to release gonadotropin releasing hormones, which along with this the secondary sexual practice all appear, and when they become united with each other, then the length, then the height fails to, like not fails to, we should say, then the height cease to enlarge, increase. Okay, so this is the main thing you want to ask me. That is the clinical scenarios. Any patient, any male who is coming with testicular volume more than 4 ml before 9 years, that is a precocious puberty. Okay, good expert. We will not talk about this. This is the age, alright. What are the types? This is the central and peripheral. Central may be isosexual. Central means what was a normal pattern of puberty that is present before 8 years. Like she's a female, whenever we take history for any child, for the precocious puberty, we always start with the pattern. What was the first sign? If the first sign in the female was the breast enlargement, then pubic hair, then menarche, this was the same pattern that is a normal physiologic phenomenon. It's also a sign of the central precocious puberty. Okay, when it is central, why, in the girls, it's most likely idiopathic, and for the girls, we usually do not go for MRI and brain radiology unless we have some specific features, like there is rapid progression, or any girl who is coming to us with 3 or 4 stage of the breast enlargement. Okay, so whenever there is central precocious puberty, we will definitely first of all go for the FSH and LH level. If they are increased, what they are producing estrogen level, it is also increased, and secondary sexual characteristics are present. This is central. So in case of central, all will be increased. Likewise, in the male, if this is increased, and this is central. And for peripheral precocious puberty, the problem was in the periphery where estrogen level was increased. When estrogen level was increased, it is going to have a negative feedback phenomena response on the FSH and LH, and FSH LH level is decreased, but testosterone level is very high. This is peripheral precocious puberty. Okay, clear? The main thing which we came across during solving the was that you have to identify, is this premature variants or is this precocious puberty. How we are going to recognize this? Premature are also known as the benign variants, which are usually present. Like in female or any child, you may have premature thelarchy. How you recognize this is premature variant or this is central precocious puberty? For this, we have to know the SMR staging. Okay, suppose let us see this diagram. This is basically the staging. Okay, and we will talk about this stage 1, stage 2, and stage 3. Okay, remember you have to know what is the stage 3 and stage 4. This is basically is going to make your difference between the premature benign variants and the central precocious puberties. Okay, what we see here is this. I said whenever you have breast enlargement in case of female, you will say this is a case of central precocious puberty. But here I would like to say this is a case of premature thelarchy. Why? Why we will say this is not precocious puberty? This unilateral, the one that is bilateral, you see here. No, this premature hierarchy may be unilateral, may be bilateral, and that may be present since birth. Here comes this point. Okay, this point comes here. Lesson 2. When the staging of the breast formation is less than 3, this is most likely a case of premature hierarchy. Okay, so how you if you see it, this is not basically the size that is going to decide this is stage 1, 2, or 3. If you see here, you have to differentiate between this nipple and this areola. Okay, yes, there is bulge, but if we see nipple and this areola, they are merged with each other. In the stage 4, you see this is slightly elevated, and this is also elevated from the abdominal skin. Basically, when practically patient comes to you, you have to see this. You are not going to see like in front of this, and this. No, you have to see this area raised and this area is raised or not. That is going to decide your staging of the puberty, and this staging is going to decide this is premature benign variant, this is central precocious puberty. Okay, is this clear up till now? The difference between premature thelarchy and precocious puberty, central precocious puberty. Clear? Okay. Is that clear? Remember, premature thelarchy may be unilateral, may be bilateral, may be present since birth. Okay, so your staging is going to decide, and you must know the staging is basically on the basis of these elevations. It's not on the size of the breast, it's on the elevation of these. Okay, so next thing, what are on the labs? What we find on the labs is this central R benign variant. Okay, for this confirmation, like we see in case of we said premature, this like central precocious puberty, LH level that is raised, FSH. Basically, we see LH level and we see estrogen level. Estrogen level is increased, LH level is increased. Sorry, on clinical basis, we also see the other features, other clinical presence features of the estrogen excess. One is look for the breast development, and what are the other effect of the estrogen in case of female, which we will see. In case of central precocious puberty, estrogen will also have effect on other parts of the body. What are those in case of female? There is reddening, there is moistening, and there is like a smoothness of the vaginal mucosa, which is a function of the estrogen. If it is a case of central precocious puberty, these changes will be present in vagina. Okay, and if it is a case of benign variant premature hierarchy, just these breast symptoms will be present, no features, no sign and symptoms on the vaginal area will be present. Okay, clear? On the labs, if we find the lab, what we see here like we do it by the gonadotropin releasing hormone. Like after giving this gonadotropin releasing hormone, just 1 minute. Child. In case of central precocious puberty, we give this GnRH to the patient, and after that we measure the level of the LH. If this is central precocious puberty, will be very high level of the LH after this hormone. And if it is a benign variant, after giving this GnRH, there is a slight increase in the LH level. Okay. Like they say for that, it's if it is more than 5, and for the premature thelarchy, it would be less than zero point 0.5. Normal level is less than 0.01, but there will be slight increase like 0.5 unit increase after giving this hormone. When the central precocious puberty, there will be very high, more than 5 international units. Like even if you remember what was exactly, they will give you the normal levels. So, clear? Is this clear now? For your exam, for your reports, you just need to know this basic idea. Okay? Clear? Same happens with the male, like here you will measure the level of LH and testosterone. Okay. But in case of male, in case of female, central precocious puberty that is usually idiopathic, we will not go for any investigation. If we see this is central and no other clinical sign and symptoms like brain tumor, any case of this, even hypothyroidism can produce precocious puberty. They are not present. But in case of male, if you find testicular volume that is more than 4 ml, you will definitely go for MRI brain. Why? Central precocious puberty is never normal in case of male. There is always a pathology in male for central puberty. Okay? Is this clear? You got to know the basic idea of isosexual and heterosexual. You must know where is the main production of the hormones and what are the clinical signs for the central and peripheral precocious puberty and how to differentiate between benign variants are these precocious puberty signs. Clear? Clear up till now? Sana, it's clear? Zaira, it's clear? Okay, so what this is now you see the difference. See, is this premature or this is central precocious? You can see the merging of this areola from this. There is no elevation. That is, this area is also not elevated. We see it laterally. There is no elevation between these areas and this nipple area. What you see here is this central or benign variant. You can clearly see the elevation here. You can clearly see the elevation here. So is this central or is this benign variant? Is this benign? Normally, huh? You see the elevation. You see the elevation here. This is central. You see nipple is elevated.